In pneumonia severity scale, most important factor is option A, age, option B, hypothermia, option C, hyponatremia, option D, mental status. Pneumonia severity scale is a very complex scale that is used to assess the severity of pneumonia. It includes two steps and it is the only decision aid for risk stratification in community acquired pneumonia. And the most important factor inside this pneumonia severity scale is age of the patient. Pneumonia severity scale is a much complex scale. In the clinical side, we use much simpler scales like CURB score, CURB 65. Let's have a look into what are the important points inside the CURB 65. In CURB 65, C stands for confusion, U stands for urea level greater than 20 mg per deciliter is very important. Here R stands for respiratory rate greater than 30 per minute is very important. And B stands for blood pressure, and systolic BP less than 90 mm per mercury and diastolic BP less than 60 mm per mercury is very important. And the age of the patient greater than 65 years, it's a risk factor. All these factors, confusion, urea level, respiratory rate, blood pressure and the age is given 1 point each. Based on that, pneumonia is classified into low risk, moderate risk and high risk. Low risk have a CURB score of 0 to 1, moderate have a CURB score of 2 and high risk have a CURB score of 3 to 5. If the score is 0 to 1, it is low risk and we have to treat the patient in OP basis. And if the score is high, about 3 to 5, we have to treat the patient in the hospital by admitting the patient. And inside this high risk patient, if the score is very high, like 4 to 5, we have to admit the patient in ICU and we have to treat vigorously. In low risk patient, the risk of death is less than 3%, whereas in moderate risk category, the risk of death is 9%, and in high risk patient, the risk of death is 15 to 40%.